I think the doctor-patient relationship is at the fundamental aspect of our delivery of healthcare. It's very difficult sometimes to understand everything that someone's going through, but if we're able to connect on some kind of personal level, and we're able to understand each other, I think that that's beneficial for both the patient and the physician, and it ultimately will lead to the patient being happier with their healthcare. My name's John Gannon. I'm a urologist. I practice medicine primarily at Riverton and Alta hospitals. My specific interest is in general urology and men's health. Men's health involves the treatment of erectile dysfunction, vasectomy reversal, Peyronie's disease, and testosterone management. Utah has been my home. I grew up in Utah. I moved to Utah when I was 2 years old and lived in Roosevelt, and then subsequently moved to Park City. And so I've enjoyed the opportunity to be back home in Utah. There's no other place like it in the world. I ultimately chose to do medicine very early in my life. My dad was a physician, and many of the people I grew up around were physicians. I tried very hard throughout high school and college not to pursue medicine. I explored a lot of other interests, but ultimately the experience around being around patients and being able to provide care led me to choose medicine. Urology as a whole has also had huge dramatic improvements in technology. You look at the advent of the robot that has been involved in laparoscopic surgery and the advances that have been involved in that. Prior to that, we didn't have a lot of options for patients that struggled with pregnancies. In that same vein, we've continued to advance the field as we begin to understand more and more about the genetic aspects that lead to infertility and our methods to treat it. Intermountain Healthcare, I think, offers some unique opportunities. Intermountain is a community-based healthcare system, and as a result of that, we have the ability to identify patients through our primary care providers, and we have an opportunity to deliver goal-directed healthcare at that level, but we also have the opportunity with multiple specialties. And because it's a large system, we have the resources and the ability to reach out to patients and attempt to deliver appropriate health care depending on their medical condition. I think I would like all my patients to understand that my goal is their goal, in that I'm trying to answer their questions, I'm trying to be honest with them, and that I will always attempt to do the right thing for them.